Alright guys, now on to fetal postnatal derivatives. It is important to know the names of the structures in both the fetus and the adult because remnants of the embryological structures are easily testable material. Many of these structures will undergo fibrotic proliferation in order to close their lumens. Essentially, they all become ligaments, which is why a majority of them have ligamentum in their names. So again, this fibrosis closes off this lumen to a very small diameter until eventually it's completely obliterated and we're left with essentially a fibrotic ligament. The allantois is an outgrowth of the yolk stalk that helps form the umbilical vessels. And the proximal portion of the allantois becomes a structure that drains the urinary bladder through the umbilical cord, which is the urachus. And here we have a cross-section of the abdominal wall. It shows us that the urachus will fibrose off and eventually become the structure labeled C, which is the median umbilical ligament. So the allantois actually sends signals to induce the development of the umbilical vessels. It makes sense how the remnants of the umbilical arteries are going to be directly next to the remnant of the allantois, which is the urachus. So the umbilical arteries are going to become the medial, with an L, umbilical ligaments. So let's review again. Directly next to the midline are the fibrous remnants of the umbilical arteries, which are the medial umbilical ligaments. These are directly next to the remnant of the urachus, which is the median umbilical ligament. There are two of these, and only one of these. Now what happens to the umbilical vein? Part of the umbilical vein gets incorporated into the liver, and the remaining extrahepatic part degenerates and fibroses off to become the ligamentum teres hepatis. The ligamentum teres hepatis is contained within the falciform ligament of the liver. This image also has some other derivatives that you will be expected to know. The remnant of the foramen ovale, or when the foramen ovale closes off, the leftover depression in the right atrium is the fossa ovalis. The remnant of the ductus arteriosus is also on this image, the ligamentum arteriosum. Remember, you would see the left recurrent laryngeal nerve looping around near the ligamentum arteriosum. That is high yield. One other thing that you could be tested about, but is not shown on this image, is the remnant of the ductus venosus. And just like the other ones where we've talked about ligamentum, the ductus venosus becomes the ligamentum venosum. So let's do an example. We have one left to cover, so let's try to test ourselves with it. So a 26-year-old female is doing CrossFit, which is a very intense form of exercise. In the middle of a power lift, she feels a sharp pain in her lower back. Rest and heat and ice therapy provide minimal symptom relief. Now the patient presents with complaints of pain with extension and tingling or paresthesias in her lower extremity. An image of a patient with a similar condition is shown. So, do you see this herniating tissue highlighted by the red arrow? What embryological derivative is the structure made from? Now this is a tough one, but examiners will expect you to know that a tear from lifting in the annulus fibrosus allows for this tissue here, which is the nucleus pulposus, to herniate and compress the spinal nerves. So here are the spinal nerves, these are the vertebra, and you can see that there's a herniation of tissue and now it is compressing on these spinal nerves. We can visualize that here. The neurological symptoms that this female is experiencing occur from the herniation of the nucleus pulposus, impinging on a spinal nerve root. So you might know all this information, but you are still required to recall what the nucleus pulposus is derived from. So the nucleus pulposus is the squishy stuff that sits in the middle of the vertebral disc, surrounded by the annulus fibrosus, which is the disc that surrounds the very spongy nucleus pulposus. So the nucleus pulposus is derived from the notochord. The notochord sets the body axis, so it's going to be in this direction. It's full of glycoproteins and collagen. The nucleus pulposus is also very squishy and is the center of each disc that provides shock absorption. All right, now on to another flash quiz. Name 3 important shunts in the fetal circulation. These are the foramen ovale, the ductus arteriosus, and the ductus venosus. Shunts are incredibly high yield because they require you to remember embryology and the hemodynamic changes that occur at birth. The ductus arteriosus and the foramen ovale are particularly high yield because of the pathologic conditions that can occur, such as cyanosis in the situation of a PDA. And what kind of cyanosis are we talking about? Differential cyanosis. And particularly high yield for a foramen ovale, because it is very rare but extremely testable, is a paradoxical embolus. Excellent job in this section, guys. Now let's do a couple of vignette-style questions before we conclude this embryology section. So a baby is born to a mother who was not immunized as a child. On gross physical examination, the infant appears normal, but on cardiac examination, the baby is found to have a continuous murmur, so that is in both systole and diastole. The physician prescribes a particular drug. So what drug did they give for the infant? And on follow-up, the murmur has disappeared. Magic, right? What is the mechanism of the action of the drug most likely prescribed? This question is testing a combination of microbiology, pharmacology, and embryology. Number 1, the mother was not immunized as a child. So think about some of the common childhood vaccinations that are very important. How about measles, mumps, rubella? This should be dancing all over the screen here, considering the child has a continuous systolic and diastolic murmur on physical examination. That is very characteristic of what? A patent ductus arteriosus, because the gradient for blood to flow from the aorta backwards through the ductus into the pulmonary circulation is always there. The pressure gradient is always there in systole and it's there in diastole. Now, rubella, the R in the vaccine, is the classic culprit that causes a patent ductus arteriosus, especially on these exams. It is associated with the PDA because the rubella virus infects smooth muscle cells that are crucial in the contraction of the ductus, and it also inhibits fibroblast function. Remember, fibrotic proliferation is key for the closure of lumens, where we get our ligamentum remnants. Now, the doctor gave a certain drug for the infant, and magically the murmur disappears. Now, what drug closed that ductus? It's indomethacin, right? But we're not done. That's not the answer. The answer is, what is the mechanism of action of the drug? That is B. Indomethacin is an NSAID. It inhibits an enzyme that is very key in the generation of prostaglandins. What enzyme are we talking about? Cyclooxygenase. Now, indomethacin is a non-selective cyclooxygenase inhibitor. It inhibits COX-1, that is always expressed, and it inhibits COX-2, that is inducible in states of inflammation. Either way, by inhibiting these two, we're going to decrease the production of prostaglandin E2. This is the arachidonic acid pathway. You can see there's a production of all sorts of prostaglandins, but we are particularly interested in prostaglandin E2 because it helps prevent the amount of vascular smooth muscle cell relaxation. We want those vascular smooth muscle cells to contract and help the ductus close on itself. So again, this means our answer was B, inhibiting the production of prostaglandin E2. Great, guys. Next one up, and the last one. A 4-year-old boy comes to his new pediatrician's office for a checkup. The boy looks generally well and is active. On cardiac auscultation, however, the pediatrician notes a low-pitched 2 out of 6 holosystolic murmur best heard at the left sternal border. Although the boy has no symptoms of a cardiac condition, the pediatrician orders an echo. What is the most likely diagnosis? This is how test question writers are going to combine physiology and embryology. We need to know our murmurs backwards and forwards, including ones due to abnormalities in development. This kid is well and active. The combination of being well and active with a murmur that is best heard at the left sternal border during all of systole, aka holosystolic, should be making you think about a VSD. When the ventricle contracts, it will project blood across the defect from left to right. When is the left ventricle contracting? Throughout all of systole, so a holosystolic murmur. We're going to shunt from left to right, creating this murmur best heard at the left sternal border. We will go through all of these murmurs in the anatomy and physiology section coming up next. Great job, guys. Keep up the good work and good luck studying.